Healthcare Final for Public Health and Well-Being by Janet L. Kitchens, Ashford University, HCA 415, Community and Public Health, Professor Eugene Elliott, April 18th to April 21st, 2014. Introduction: Promoting Public Health and Well-Being in Your Community, a New Perspective on Health Promotion and Disease Prevention. Have you ever wondered what practical thing you could do to improve the health and well-being of the local community? If so, this Public Health Association of Maryland, New York has devoted this guide to promoting public health and well-being in your community. It is for you as well as your physicians. How to get started. To understand what public health really means, we need to begin with what health means. That will give us a firm foundation for then identifying how to distinguish public health from other health arenas. That will give, for instance, health is characterized as a fundamental human right, and attaining the highest position level of health as an important worldwide social goal. Furthermore, the Declaration recognizes and realizes this goal requires the action of many other social economic sectors in addition to the health sector. Public health is a preventative. Public health is a practice of preventing diseases and promoting good health within a group of people from small communities to entire countries. Public health is policy development and population health. Public health professionals rely on policies and research strategies to understand issues such as infant mortality and chronic disease in a particular population. Well-being or welfare is a general term that the condition of an individual or group, for the example, their social, economical, psychological, spiritual, and medical state. High well-being means that in some senses the individual or group experiences a positive, while low well-being is associated with negative happenings. So the well-being of a population should be protected and protect the community's population in monitoring their social, economic, psychological, spiritual, and medical state. In this slide, it describes the role of the community and public health in the well-being of the population. There are many people that actually contribute to this, such as EMS providers, inspectors in for restaurants and food stores, people that educate in the healthcare field, people using to study such as scientists and researchers, physicians and nutritionists, nurses, occupational health, safety professionals, social workers, community planners, and many, many more. In slide 4, while the structure of the public health system varies greatly from state to state, experts have identified the following as core functions of an effective public health system. Preventing disease. Controlling and preventing disease from infectious disease such as HIV, tuberculosis, and chronic diseases such as diabetes and arthritis. There are major concerns of public health agencies. Public health agencies work with hospitals, nursing homes, schools, environment health agency, physicians, laboratories, citizens, and federal agencies to explore the cause of sources of certain diseases and try to determine the appropriate response to the outbreak. Protecting against environmental hazards. Environmental hazards such as mercury, pesticides, air and water pollution, and lead can have significant effects on the health of our population as a whole, but they are often undetected. Other goals of public health is to minimize the public health exposure to such environmental hazards. Health departments work on environmental issues which can include addressing air problems, protection from toxic exposure, assessing chemical risk, managing materials that can be hazardous, screening for lead exposure, establishing different programs, managing toxic and solid waste, controlling the quality of water, preventing injuries. Public health agencies implement strategies that can prevent many kinds of injuries. Safety and injury education programs cover a variety of injuries from the motor vehicle crashes and agricultural accidents to violence and suicide prevention. Examples of other activities include residential smoke detectors installed in programs to help monitor and campaigns to improve seatbelt use. Promoting and encouraging healthy behavior. Health departments ensure communities in health and disease prevention areas such as nutrition and physical fitness, smoke sensations, and early detectors of breast cancer. Agencies analyze with chronic disease risk are most common in their communities and then initiate activity to increase awareness and understanding of prevention for these measures. Frequent working with the private sector associates and community groups to promote and provide education about healthy behavior. Number 5. Responding to disease and assisting communities in recovery. Public health demonstrations are involved in protecting the community from the immediate and long-term effects of a national disaster and man-made disasters. Health departments work with agencies and emergency management organizations to identify response to and mitigate natural disasters and threats to the community. Ensuring the quality and accessibility of human services. Health departments evaluate medical capacity of communities, including quality of the accessibility of health services. Ensuring quality involvement license of health facilities and coworkers. Ensuring access sometimes involves providing actual health care to people who lack insurances or cannot access private providers for services such as prenatal care, immunization, and pediatric dental care. Ensuring access can also be involved in coordinating among agencies to develop programs in health centers, schools, and communities, and establish referral sources. What are some of the things that the community and state are doing to promote well-being in a community? They offer vaccination programs for school-age children and adults to prevent the spread of disease. They regulate any prescription drugs for safety and effectiveness, safety standards and practices to produce workers' health and safety. They ensure access to clean water and air, educate campaigns to reduce obesity also for young children, measures of effective air and quality of emergency recovery workers. School nutritional programs are also offered to ensure that the children have access to good nutritional foods. In the next slide, it describes the public health organization process. The public health system once was a comparison of only official government, public agencies. Today, we know that it takes more for public health to succeed. The 4 main components for the public health system are as follows. They look at the mission. The mission of the public health system includes its goals at the point in time and how, at the conceptual level. These goals are operational. At the beginning of the 21st century, the mission of public health is to ensure conditions in which people can be healthy. The structural capacity of the public health system is the communicative resource and relationships necessary to carry out the important processes of public health. Structural capacity includes the following elements: information resource, organizational resources, physical resources, human resources, and fiscal resources. The process. The practice of public health can be thought of in terms of the keys of processes through which practitioners seek to identify, address, and prioritize community and populations-wide health problems and resources in the outputs of these more fundamental processes, public health interventions, policy, regulations, programs, and services. The process of public health are those that identify and address health problems as well as the programs and services consistent with mandates and community policies. Outcomes. The immediate and long-term changes experienced by individual, families, and community providers and populations are the system's outcomes. The cumulative results of the interaction of the public health system in structural capacity and processes give the micro-contact and the system's mission and purpose. Outcomes can be used to provide information about the system's overall performance, including the effectiveness, the efficiency, and the ability to achieve quality. In the next slide, just kind of demonstrates and examine the legal and ethical dimensions of a public and community health service. The first side says clinical ethics. The clinical ethics basically focuses on the patients and not the community, like the public health ethics focus on the population, the institutions, and the communities. Individual ability and autonomy is the clinical ethics. Independence of the people is for the public. Clinical ethics, again, looks at the patient's quality. As for the public health, they're looking at the society's quality. The complementary roles of public health and public health laws. Why consider law in ethical training? Laws defend the boundaries of lawful actions. Laws may also be used as a starting point for consideration of the public health action. Laws may rely on common ethical practices. Laws may also reveal social and moral consensus. Laws and legal advice may provide the homework for decision making also. This will end part 1 of this presentation. We will continue for part 2 in another slide.